Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about pink eye, one of the most common eye conditions that sends people to urgent care and keeps kids home from school. If you've ever awakened with crusty red, irritated eyes, you've likely encountered conjunctivitis. It causes a lot of anxiety and confusion. Is it contagious? Do I need antibiotics? Can I go to work? Well, here's what makes pink eye tricky. Not all pink eye is the same. There are three completely different types, and they require different treatments and different precautions. One clears up on its own, another needs antibiotics, and the third isn't even contagious at all. Today, we're demystifying pink eye, the three types, when you need to see a doctor, and how to prevent spreading it. The three types of pink eye. Pink eye, or conjunctivitis, is inflammation of the conjunctiva, that clear membrane covering the white of your eye and lining your eyelids. When inflamed, your eye turns red or pink, hence the name. There are three distinct types, and understanding which one you have changes everything. First, viral conjunctivitis, the most common and most contagious type. It causes burning red eyes with watery discharge and spreads incredibly quickly in schools and crowded places. It's usually caused by the same viruses that cause the common cold, so it often comes with a runny nose or sore throat. Less commonly, it's caused by more serious viruses like COVID. The key characteristic is that watery discharge, and it often affects both eyes, starting in one and spreading to the other a day or two later. Second, bacterial conjunctivitis. This is less common, but also very contagious. The telltale sign is thick, sticky pus, often yellow, white, or greenish, oozing from the eye. Many patients wake up with eyelashes stuck together from discharge. It causes sore red eyes and spreads easily through direct contact. Sometimes it's the same bacteria that causes strep throat. Third, allergic conjunctivitis. Fundamentally different because it's not an infection. It happens when your eyes react to environmental triggers like pollen, pet dander, cigarette smoke, or pool chlorine. The defining feature is intense itching. Your eyes become very itchy, red, and watery, and eyelids may become puffy. Here's the critical difference. Allergic conjunctivitis is not contagious. You can't catch it or spread it because it's not caused by infection at all. Who gets pink eye and how? Well, children are much more likely than adults to get viral or bacterial pink eye. Kids in school and daycare are in close contact, and they're less diligent about hand washing, and they touch their faces constantly. Infected surfaces, unwashed hands, shared toys, all become vectors for spreading conjunctivitis. When we see outbreaks in schools, they spread remarkably quickly. One child comes Monday with pink eye, and by Friday, 5 more kids will have it. Adults tend to get pink eye differently, mainly from improper contact lens care. Not cleaning lenses correctly, wearing them too long, sleeping in lenses not designed for overnight wear, or using decorative contacts that don't fit properly. These are common causes of infections that can lead to corneal ulcers. Adults can also get it from touching contaminated gym equipment and then rubbing their eyes, or just touching anything like a doorknob or an elevator button. The most common transition routes are direct contact with bodily fluids from infected people, spread from bacteria in your own nose and sinuses, and contamination from poorly maintained contact lenses. What are the symptoms? How do we diagnose this, and what is the treatment? Well, common symptoms include a gritty sensation like something's in your eye, redness, discharge that can make your eyelashes stick together, burning, itching, pain with bacterial forms, watery eyes, puffy eyelids, and blurry vision. Your ophthalmologist examines your eyes to determine which type of conjunctivitis you may have by looking at the redness pattern, the discharge type and amount, and asking about associated symptoms like cold symptoms or allergies. For treatment, and this is crucial, viral pink eye has no treatment or requires no treatment. Antibiotics do not work on viruses. Your body fights it on its own within 1 to 2 weeks. You can use cool, wet washcloths and artificial tears for comfort. Throw away eye drops after recovery to avoid reinfection. Now, bacterial pink eye may need antibiotic eye drops depending on severity. However, mild cases often will resolve on their own. Your doctor assesses severity to decide if antibiotics are necessary. Remember, antibiotics will not help viral or allergic pink eye. Allergic pink eye responds to allergy eye drops for itchiness and puffiness. If a chemical got in your eye, rinse it thoroughly and use eye drops your doctor recommends. Most conjunctivitis resolves within 1 to 2 weeks. If symptoms persist longer, see an ophthalmologist to rule out more serious problems. Prevention and when to stay home. This is critical. If you have allergic conjunctivitis, you're not contagious. Attend school, work, or the gym safely. But if you have bacterial or viral pink eye, stay home and avoid contact with others until your eyes are no longer red with discharge. Prevention strategies. Wash your hands frequently, before eating, after bathroom use, after sneezing. If caring for someone with pink eye, consider wearing a mask and gloves. Use clean towels every time you wipe your own eyes. Don't wear contact lenses while infected, and replace them with new ones after recovery. Don't use eye makeup while infected. Bacteria can live in makeup and cause serious corneal infections. Replace all eye makeup after you recover. Never share eye makeup. Avoid touching your eyes. If you do, wash your hands immediately. In conclusion, pink eye comes in 3 types: viral, bacteria, and allergic. Each has different causes, treatments, and contagious levels. Viral is most common and highly contagious with no specific treatment. Bacterial may need antibiotics. Allergic conjunctivitis is not contagious and it responds well to allergy treatments. Remember, proper hand hygiene, avoid touching your eyes, and know when to stay home. Most cases resolve within 1 to 2 weeks, but see an ophthalmologist if symptoms persist or worsen. It's especially important to see an ophthalmologist if you've had recent eye surgery or if there is loss of vision or pain. Thank you for joining me. Subscribe and share with your friends and family, especially those with school-aged children. Until next time, keep your hands clean.